This is Selma Schimmel for the Group Room at the ESMO 2012 Congress happening now in Vienna. Very pleased to be joined by Professor Christoph Zielinski, Director of the Clinical Division of Oncology and Chairman of the Department of Medicine at the Medical University of Vienna. Professor Zielinski is also President of the Central European Cooperative Oncology Group, and I'm so pleased to see you here.
Thank you.
You are going to give us an update about what's happening here at ESMO with breast cancer data, research, maybe some of the compelling highlights.
Now the fourth aspect, which is the amelioration of diagnostic measures, was presented by Dr. Fabrice André, who presented a very important trial of genomic sequencing and genomic data, presenting genomic data in patients with metastatic breast cancer, showing the feasibility of this approach, and also showing that an enormous number out of these patients, I believe it was like more than 2/3 of these patients who were tested, would be recruitable for personalized treatment. And they already started with this kind of personalized treatment according to the genetic pattern that they have discovered. And we're looking very much forward to see what will happen there. However, this is quite interesting because this is an absolutely new approach because, of course, a lot of compounds could be used in this context, which are not definitely and which are not registered for their use in metastatic breast cancer. So we might learn during the next couple of years that regulatory agencies might be asked to rather register for pathways than for anatomic locations. So that is a challenge to everybody.
What are some of these pathways that we hope to identify?
Well, the latter aspect already popped up for HER2-positive gastric cancer, where the TOGA trial showed that the inclusion of trastuzumab with chemotherapy led to an amelioration of the endpoint as chemotherapy alone, showing that HER2 overexpression is not limited to breast, but it can be also at completely different locations, and then its targeting might lead to an amelioration of outcome. That is not always the case is also true and has to be always tested in clinical trials. So the mere overexpression of one or the other pathway is not necessarily a guarantee that one or the other treatment will work, which is directed against this pathway, because it might be just sort of lying there, or it might be biologically uninteresting for this tumor type, or it might be crucial. Now, what we're talking about here is, of course, the identification of genomic or of molecular biology characteristics where we do have targeted drugs against. And we are having more and more targeted drugs, or such drugs where we could expect that one or the other characteristic of the cell might make them amenable to treatment. So that is quite an intensively researched area right now.
Are the PARP inhibitors showing any increased efficacy in breast cancer?
Well, we're witnessing right now a relaunch in PARP inhibitors after some kind of disappointment at the very beginning of the development due to a variety of different aspects, which I don't want to go into right now. But again, PARP inhibitors are coming up again, and we're looking forward to see the results on that.
So how long have you been practicing medical oncology?
Well, I started out in '79, and at that time I think we had like 5 drugs or 7 drugs, I don't know how many. Now there's 930 in development, so we're quite excited.
And just a personal question, what does it feel like for you as a medical oncologist able to really live through and play a active and dynamic role in this transitional time of where we are with genomics and personalized medicine?
Well, I personally am an aficionado of human intelligence. So I love to see and watch this, how things evolve, and something being present where nothing was there before, and this built on a collective intelligence, because individually we might not be that intelligent, but collectively I believe we are.
I think that your patients really must like coming to see you as their doctor.
Well, some of them tell me, if you see me in the street, don't greet me, because they don't want others to realize that they have cancer. So we're working even more on the removal of taboos and of forming and shaping society in such a way that cancer becomes a disease like any other. And the progress that we're making helps us enormously because, as you said before, hope lifts and takes away taboos.
Thank you. Professor Christoph Zielinski, Director of the Clinical Division of Oncology and Chairman of the Department of Medicine at the Medical University of Vienna, also President of the Central European Cooperative Oncology Group. Thank you for this comprehensive ESMO breast cancer update.
Thank you.